And as Kirsten Bartle said, I am truly blessed to have the wonderful job that I do, right? I really get to have a wonderful experience working with students and get to sort of talk about social justice professionally, right? That's part of my job. So I come today with sort of a multitude of my identities, right? So I'm a mother of a 5-year-old, I am a professor, a child of the 70s, I'm a CSA member, right? And all of those components and many others sort of inform how I think about women's health issues and environmental issues and how they're interconnected. And so for me, in terms of thinking about sustainability and sort of sustainability issues too, I really want us to think about how we're all connected and then we have to act accordingly, right? So these are important issues about really sort of thinking about the connected nature. I also sort of identify as an ecofeminist, and I'll tell you a little bit more about what that means when I sit down, but really sort of thinking about talking about women's health issues and the importance of women's health issues and being on the public health panel. So my research, one of my main focuses of my research is about media messages of breast cancer. And so in particular, I look at print magazines and I look at the October issues because October is Breast Cancer Awareness Month in the United States. And so when I started looking at these magazines and sort of really looking at the messages about breast cancer, I was really concerned with what has been termed pinkwashing, right? This idea that we might slap a pink ribbon on a product, even though the product itself might be harmful, right? Somebody at lunch was talking about like parabens and phthalates, right? The problems in our beauty products, right? So Estee Lauder gives us a pink ribbon product, but yet they still have harmful toxic chemicals in their products. So this idea of pinkwashing, right? So they're simultaneously sort of telling us that they're doing something about breast cancer where there's really meaningful and important things they could be doing about breast cancer that they're not doing. And I'm also concerned with the way that we sort of this pinkwashing and other sort of media messages about breast cancer really encourage us to sort of approach breast cancer as consumers, right? We're supposed to address breast cancer by buying stuff, right? Buying pink M&Ms or buying, more products, right? And they're really about individual solutions to what I see really needs a societal solution, right? So the kinds of public health issues that we're going to talk about on our panel aren't really ones that we're well able to address as individuals. We really have to address them collectively. So that's what I wanted to talk with you all about and sort of think about this way that we've been sort of encouraged and conditioned to think about these as sort of more about like what I can do as an individual, like what am I eating, what am I wearing, what am I buying, and rather I'd like to shift the conversation to sort of a more collective group conversation.
And our mission is to improve children's health and well-being by eliminating harmful housing conditions. So I started with the organization back in 2007, and in 2008 was when we started our direct service program. We address a multitude of environmental hazards in the home in really 3 different ways: through outreach and education, through advocacy and policy work, and then through direct services. So I'm in charge of the direct service component. Outreach and education is basically what it sounds like. We go out, we are at health fairs, health events. We teach classes about how to maintain a healthy home and healthy lifestyle for their children. And then policy work is centered around what can we do at the local, regional, and federal level to help ensure that our children are living in safe environments. Our direct service program, last year we went into more than 250 homes in Grand Rapids, and we helped these families, low-income families of young children. So they have children in the home, 0 to 6, and we help them address their environmental hazards. We go in and we do a comprehensive assessment. We work with the family one-on-one for a period of 3 months to a year. And some families we've actually worked with for 3 years at this point because they have many different issues in the home that need to be resolved. But we know that it can take a long-term commitment to be able to address them all. Our work really is about empowering these families. It's not to just go in there and say, okay, you have A, B, and C that you need to take care of. It's, look, here's what we're finding. Here's our recommendations as an organization. But realistically, we know because we are working with a low-income population that there are many things they may not be able to afford to do. So one of the main hazards that we tend to work on is lead. Those of you probably have heard of Get the Lead Out. It's an organization it's a collaborative actually that was formed back in around 2001 to help prevent childhood lead poisoning. Healthy Homes Coalition was actually formed out of that collaborative. We started going into homes and we saw that there's a lot more than just lead in homes. There's radon. There's asthma triggers, something that people aren't really thinking about, but asthma prevalence is really on the rise for children. The current asthma prevalence rate for all children is 9.6%. That's a lot. That's almost 1 out of 10 children. Now, if they're children living in poverty, it's 13.5%. If they are a minority, it's even higher depending on what their ethnicity is. So we're seeing a lot of social justice issues in there too. And this isn't just children it's affecting, it's the women too. I can tell you that more than 90% of the families that I work with, and I call them families, we don't look at them as clients, they're more like partners to us, but it's really the mom that I'm working with. It's very rare that I'm working with the dad, and that's because we know that our role as women, we tend to be the primary caregiver of our children. We are the ones that tend to put the food on the table, cook the dinner, make sure that the house is suitable for our children. And I'm not saying that dads don't have a role in that, but realistically, the homes that we're going into, 90% of the time, it's mom, if not more. And so our role is to really walk alongside that with the family and help them figure out where those hazards are, what can they do about it realistically. With lead, they may need new windows, but can they afford them? Okay, maybe not. So what else can we do? We teach them low-cost solutions to reduce the risks. They may not always be able to eliminate them because of the fact that they are living in poverty, but we can at least reduce them as much as possible so that these children don't end up with these long-term effects that can lead to ADD, ADHD, high school dropout rates. We know that asthma has also been linked to more missed days of school. The more school you miss, the more likely you are to fall behind than your peers. So not only is healthy housing an issue for women and for children, it's also an issue for our society, because then we have more children that are failing in school because of the indoor environment that they're spending their time in. Children spend more than 90% of their time indoors. Young children, 0 to 6, tend to spend that time in their own home environment too. So we really need to take a holistic approach and look at the home that we're living in and how it can be contributing to our own personal health for not just the women, but the children there as well.
I'm farm raised, small farm in western Pennsylvania, and I think we were organic because we didn't know what else to do. And it was, you took the cow poop from the barn and you put it in the garden. That's just what you did. And you saved the seeds from one year to the next year. And so that's, I guess I had a beginning that I didn't appreciate for a long time because I couldn't wait to get off the farm, And now I want to live on a farm again. But I'm married to somebody who doesn't want to. So, but I also developed a strong sense of social justice because of the way I was raised. And social justice drove me into healthcare. I kind of went into healthcare because at the time I was educated, women were supposed to become nurses or teachers. But I made nursing into something that I really, really liked. I became a nurse practitioner and went into women's health. And I began to see the need for social justice, for advocating for women when I worked labor and delivery in a small hospital outside Pittsburgh and saw the way that women were treated and how they were not represented, but how they were managed by the power hierarchy in medicine, and they were not regarded enough as women. And then I went on to become a nurse practitioner, went into practice here in town, and I taught for a long time. Getting into the teaching and looking at the social justice perspective, when I was at Grand Valley, I did have a project in Nicaragua that Julie went with me a couple of times, and we did clinics in the mountains of Nicaragua. Linked with the local school of nursing, a local college of medicine. We took our NP students, our undergraduate students, with us to Nicaragua, and we saw social justice from a different perspective. It was really fascinating to take students there and to put them in a position of becoming a minority and not being able to escape and have to stay with it and work it out and find a way to make it work in the context of their homes and their lives. And we tried very hard not to. We went back every 6 months, but one of the efforts was not to have the people there wait for us to come back in 6 months, wait for us to bring the blue pill, wait for us to bring the pink pill, wait for us to bring the magic pill from the United States, but to learn about the way local people handled health care. And that's when I learned to steep a lemon leaf tea to rinse wounds to help disinfect them. And that's when I learned to use some herbs so that we could incorporate them into what we were doing. It was a fascinating experience. And that's also a social justice issue, to look at the wisdom women have developed over the centuries and thousands of years and respect it and use it because it works. It works. So because of that, I've been able to incorporate a lot of holistic health into my allopathic education as a nurse practitioner And even now working with the residency programs, sometimes they look askance at me, but you know what? They need to learn this stuff too. Did a practical health show with Shelley for 12 years did we do that? Once a month. So she learned to have the bleep button ready really quick during that. Yeah, it was a good time. But you two talked about having a social approach. Really, even though I talk about social justice, as a nurse practitioner, I look at the individual and I work with the individual. 25 years ago, doing breast exams on women in my practice, I noticed that women who were being prescribed Premarin, which is a synthetic estrogen drawn from the urine of pregnant horses, that I noticed when I examined their breasts that their breasts were dense and firm, so firm I couldn't even press sometimes to the chest wall to find out if there was a tumor against the chest wall. And I thought, there's something wrong here. So I called up the pharmaceutical representative and said, what's wrong with this estrogen? I'm not going to prescribe it anymore. And so they brought me gifts, they offered to send me on trips, brought lunch for the whole staff. And I'd say, well, thank you for some of these things. Well, I'll take the pens, but I'm still not going to prescribe your Premarin. And then, 15 years later, they come out and say, Premarin's not safe to take. Still on the market, but it really isn't safe. So if you look at things through the individual woman's eyes and see how the pharmaceuticals are misrepresenting what they're selling. On one hand, they're selling pesticides. On the other hand, they're selling cancer treatment, the same companies. So looking at through the eyes of what the woman needs and then looking at that, then building that into a larger issue is kind of what I do. So I talked enough.
We talked about this a little bit at our tables at luncheon, or at our table a little bit from luncheon, but sort of the environmental racism, right, and sort of the ways that so women in general, and then minority women in particular, face a greater share of the toxic burden, right? So they're working in more occupations that are likely to put them in contact with hazardous chemicals or hazardous working conditions. They're also primarily going to be, there's a disproportionate number of people, so poor people, people of color who are living in neighborhoods that are closer to toxic dumps because of the sort of not in my backyard philosophy, right, where sort of toxic contaminants are going to be sort of foisted off on people who have sort of less political, social, and economic power to sort of keep them away. And so I think all of those things are sort of parts of how, when we have this conversation, we have to sort of really look at and think about the way that sort of, so a couple of people earlier in the day had sort of alluded to like sort of certain kinds of environmentalism have sort of become sort of trendy or hot, but they're not necessarily about this kind of environmentalism.
All right. Well, so in houses, really what we're seeing is there's old houses versus new homes, right? They each have their own different set of issues. I can tell you primarily I work in the older homes, but I can still speak to some of the newer homes. Older homes, especially ones built before 1978, likely contain lead-based paint. And I know that you heard me talking a little bit about it earlier, but the thing with lead that a lot of people don't realize is that children are still being poisoned from it each year. Last year in Kent County, I believe it was 73 children that were poisoned by lead. What the studies are showing is even that low-level exposure. And when we think of exposure, we're not talking about children going around eating paint chips. It's not quite as simple as that. They're not just picking them up and putting them in their mouths. It's the deterioration from those friction and impact surfaces. So windows, for example. When you have an old home with windows, we all have windows, right? But if you haven't replaced those windows, when you open and close them repeatedly, that becomes a friction surface, and that paint starts to deteriorate. Even if that paint looks like it's in good condition, it is deteriorating into a very fine dust. That dust is what we call lead dust. Lead dust is invisible, you can't see it. It's sticky too, so it sticks to that window sill or that window trough. We are all pretty familiar with the behavior of young children, especially around the ages of 1 and 2. They are very oral. They have a lot of hand-to-mouth behavior. So repeated exposure to this, they touch it, they put their hands in their mouth, they touch it, they put their hands in their mouth. It settles onto their toys, they put that into their mouths. Eventually, what could happen is they could end up lead poisoned. Lead poisoning has been linked to ADD, juvenile delinquency, high school dropout rates. They have learning disabilities, so they're really at a significant disadvantage. And we know that people who are living in poverty are more likely to have children that are lead poisoned because of the conditions of the homes that they're living in. Carbon monoxide is from the off-gassing fuel burning appliances that are malfunctioning, so like our furnace or a gas stove, and it can actually kill you in your sleep. And most of the families that we work with can't afford a carbon monoxide alarm. Those alarms cost $40, but when a family is faced with having to put food on the table for a week or purchase a carbon monoxide alarm, they're going to purchase food or pay their gas bill or whatever it may be. So the least glamorous part of my position, but I'm going to talk about it anyways, is that pests can actually contribute to asthma. Pests like roaches and mice, okay? I'm just going to go out and say it, cockroaches, okay? They're gross. We don't want them in our homes, but there are many people out there who are living with them in their homes, and what that does is there are some recent studies actually that have come out that say that children living in an environment with cockroaches, preschool-age children, are more likely to develop asthma. So there's the causal development link there. That's really significant because what that's saying is if we can get into these homes and get them out before a child develops asthma, we could be preventing that from happening. We know that environmental tobacco smoke is also a link to a child developing asthma, and cockroaches is on the same scale as that. And if a child already has developed asthma, roaches also trigger asthma attacks because it's an allergen. And many people who have allergies also, or many people who have asthma also have allergies. And so it's really important for us to address those allergens in the home. So we teach them what is called integrated pest management. That's really a holistic approach to addressing the pest problem in the home. We're not just going to say, okay, we're going to kill them and then we're out of here. It's, okay, what are we using to kill them, first of all? Is it safe for the people in the home? Is it safe for the environment? What are the behaviors of the people in the home that could be contributing to the problem? What needs to be addressed on a behavioral level? And what is the structure of the home that is also contributing to the problem? There's certain habits that people have that aren't necessarily the healthiest. It doesn't make it wrong. We're not judgmental about it. It's a different style of living. Maybe it's something as simple as not doing the dishes every night. It could be that they don't have a common eating place. You know, they eat all over the house in our air fresheners. I can't tell you how many homes I go into where there's that little puff that follows me because they have that automatic air freshener that contains volatile organic compounds, which some of them are carcinogenic. And then also they are, for people who are sensitive, they're terrible for our lungs and for our skin too. And then they're using things on their carpet, like those carpet deodorizers, or they're using cleaning products that aren't safe for their children or for them to be using either.
Everybody sitting in this room is a repository for toxins. Every one of you has a toxic body because you live in this world. Some of it you can do something about, some of it you cannot do something about. But women in particular carry a big risk because of our endocrine systems. Our endocrine system makes us more susceptible than men in many ways to environmental toxins. So what's your endocrine system? It's the system of glands that produce hormones and the system in your body that is made to absorb those hormones. And now enter pollutants. One of the more dangerous pollutants for women are called xenoestrogens. And it's not Xeno, warrior of the whatever she was, but it's xenoestrogens, X-E-N-O. They are petroleum byproducts. They're synthetic estrogens that your body cannot distinguish from your natural estrogens. So when you are exposed to a xenoestrogen, it almost seems to travel more quickly to your breast or to your vagina or to your uterus and be absorbed. They have all these extra arms on them. Your body absorbs those extra arms and doesn't know what to do with them, and they overstimulate your different cells in your body to proliferate or to grow. So your breast tissue becomes overstimulated to reproduce cells that are not normal. then you have breast cancer. For instance, parabens, if you have a container of lip balm in your purse, hand cream, makeup, flip it over and look at the back. If you see anything on the label that says paraben, might be butyl paraben, ethyl paraben. If it says paraben, P-A-R-A-B-E-N, you are putting a xenoestrogen on your skin. So these xenoestrogens are endocrine disruptors. They disrupt your endocrine system. They cause things like endometriosis, breast cancer, abnormal weight gain, cravings, food cravings and allergies. Phthalates, P-H-T-H-A-L-A-T-S. You familiar with phthalates? Mm-hmm. They make your nail polish not chip. They help to hold the color on your lips. They help to make the fragrance from your perfume stick, so you don't smell like the musky natural smell you're supposed to be. You smell like a synthetic rose. Phthalates are plasticizers. They're called plasticizers. They're made to make things kind of stick like soft plastic. And it goes and it sticks in your breast, and it sticks in your vagina, and it sticks in your uterus, and makes abnormal things grow. In research and statements on WebMD or the Center for Disease Control, that this much exposure to this particular topic, like a BPA, this particular item, like BPA or parabens or phthalates, if you have only this much exposure, it's considered to be safe. What they're talking about is a one-time exposure, one time in your life to that product. They're not talking about multiple exposures. Now, how many of you have picked up a plastic bottle one time in your life? How many of you have put on hand lotion one time in your life?
I think there are important things that individuals can do, but I also think that, like, what I meant about societal was that, like, as a society, we have to address getting rid of the parabens, getting rid of the phthalates, right? So that makes the choices easier for folks. And as somebody mentioned at lunch, right, other countries have done a better job. Some of the same cosmetic companies will sell one product in the European Union that has gotten rid of those toxins, and they'll sell the same version of the product with the toxins in the U.S. because we haven't demanded that they take them out. You're sort of fooling yourself into thinking, like, if you bathe in the water, you're getting, like, if your water is contaminated and you're bathing in it, or if you run a dishwasher, right, you're getting contaminants from your water. So really about, like, addressing the problems of the water at the source, right, then sort of thinking about, okay, as an individual, I'm going to make sure my own water is clean, right? Okay, that may be important for some individuals, but really sort of thinking beyond that, right? Like, I want to make sure everybody in our community has access to safe and healthy water.
That's a really good question. I would say that when I first started this position in 2008, it was about 50-50 down the line. But since then, there's been the mortgage crash and a big foreclosure crisis in the Grand Rapids area. So we're starting to see it's probably more like about 65 to 70% that are renting now, and then 35 that are homeowners. We do end up dealing a lot with landlords and teaching tenants how to advocate for their rights, letting them know that there is a city code that their landlord has to abide by, teaching them how to make, a simple request for repairs. You'd be surprised how few people know how to do it the proper way, and then they just end up saying, well, I'm going to withhold my rent and call it good, and then their landlord evicts them. So we end up having to help them navigate the system a little bit.
Right, so this is one of my sort of biggest issues, right, in sort of the way that we talk about, and again, this idea of, like, why I want to move us from talking about it as an individual issue. So Susan Love, who's one of the sort of the preeminent breast cancer doctors, talks about, like, sort of like slash, burn, and poison, right, are sort of the ways that we're dealing with breast cancer. But really sort of like it's a much longer conversation than we have time for today, but really sort of looking at the way that the pharmaceutical industry, right, this idea that Gayla mentioned about, like, so a lot of those industries were both sort of selling the carcinogens and then also selling the cure, right? They were involved in sort of both ends, profiting off both ends of the spectrum. But the way we sort of have a conversation about it, right? So it's race for the cure, right? All of these events for the cure. And cure, don't get me wrong, cure is enormously important, but I'd like to start with prevention, right? With sort of, we need to stop it from happening in the first place, right? And so even, sometimes the rhetoric about early detection, right? Early detection is your best prevention. Well, no, early detection detection is important, right? We're getting it early, but that's not prevention, right? Prevention is before you have cancer.
The pharmaceutical companies spend more money on marketing than they do on research. Yeah. And they spend a lot on research, all right? And most of the research is spent on tweaking the genetic, the formulation, the patented formulation, so they can put out say it's a new drug, but it's really just a tiny little tweak on the existing drug. So as an individual, when you if you have to go to see your nurse practitioner, your physician assistant, or your physician, and they say, you really need to take this prescription, and you're thinking, yeah, I need to take something, I have a, bad infection, whatever it is, and they'll say, and they'll write for the new drug that's on the market. What you say is, I don't want the newest one. I want the old one that works just fine. We, as individuals and as a society, have a responsibility. I will, at a grocery store, if somebody's picking up something that I know is just dangerous, I'll say, this other product, and some people appreciate it, and other people are like, get away from me, you weird lady. But I have a responsibility to my fellow women to say this has parabens in it, and paraben has been identified in breast cancer biopsies. And the other thing that you alluded to that I want to bring up also is the issue of trust, power, and race differentials that impact the ability to trust. When you have a history of power over another group, dominance, and wealth and money, why should? I remember sitting on the prostitution roundtable in town, sitting next to a woman who did work on the street because that's how she made her money. She also was a patient of mine, and we did this little ditty. And I said to her in a role-playing thing up front, I said, you really need to use these super-duper condoms because, and she looked at me and she said, why should I listen to you, Cracker? And I said, you're absolutely right. Why should you listen to me? Because why should you trust me? So you have to work through those trust issues in order to identify the disknowledge, to get the knowledge out there.
When you asked us to think about sort of how it sort of disproportionately affects people, so people who are poor and sort of more toxic burdens, and so this sort of piece about that we know about, like sort of recognizing the historical racism in our healthcare system. To see this very white sort of image, sort of white and sort of very young, that doesn't necessarily match up with who gets breast cancer. And then we know too from the stats that women of color often are it's detected later, right? So that there's sort of so all of these pieces sort of work together, and they need to be part of the conversation that we're having, right? When we're going to talk about these public health and health issues, it's not just about sort of what individuals or people are up to, but sort of the way that this systemic poverty and inequality and racism and homophobia have functioned to sort of put some people at different levels of advantage. Right?